When I get older, losing my hair, many years from now, will you still be sending me a Valentine?
Good afternoon. Welcome to Elder Service of Berkshire County's Berkshire Senior Television and Radio now. We will be coming on the radio shortly with the same programming. Today I have with me Shauna Post, Regional Director of SHINE. Being that it is open enrollment season for Medicare, we thought you are the answer to all our questions. Welcome. Good afternoon, Shauna.
Well, thank you very much. I'm very happy to be here. Great.
So, first of all, what is SHINE?
SHINE stands for Serving Health Insurance Needs of Everyone. It is a primarily volunteer-based program that is overseen by the Executive Office of Elder Affairs, and we are part of the National SHIP program. We offer free, unbiased counseling to any Medicare beneficiary, regardless of age. We help them evaluate their coverage, navigate the Medicare network. We can help with appeals to a certain extent. We also have extended partnerships with the Medicare Advocacy Project and things like that to basically assist anyone with their Medicare needs.
Fantastic. Now, this is a part of Elder Services.
Yes.
Go ahead.
Our regional office is at the Elder Services. I am an employee of Elder Services of Berkshire County, but we operate out of many different locations throughout the county. We've actually trained 17 new counselors this year. So, you know, individuals can seek help from Elder Services, but also at their local councils on aging. We also partner with multiple nonprofits throughout the agency and also have a partnership with EcuHealth in North Adams, which is their local navigator. So we're pretty far afield.
That's fantastic. So it seems like you're pretty accessible throughout the county. Now, for those of us who aren't quite to 65 yet or are helping somebody else that might be at that point, what is open enrollment?
Open enrollment is the period between October 15th and December 7th, which is when every beneficiary, regardless of their circumstances, has the opportunity to evaluate their drug coverage options. So they have the option to enroll in a plan for the first time. If they perhaps missed their initial enrollment period, they have the option to change their plans. They have the option to go from Part D coverage over to Part C coverage. Mm-hmm. I know there's quite a lot. Basically, it's an opportunity for them to evaluate their coverage. And the reason that this is so important is that the plans change every year. Last year, we actually saw a plan that was semi-popular. There was a pretty good middle of the road. The premium was about $30 a month, and the premium went up 242% overnight. Also, formularies can change, so a drug that might have been covered previously might not be covered anymore, or it might have been moved to a higher tier, which means it will cost more. There's actually 26 standalone drug plans available in Massachusetts, and then here in Berkshire County, we have 5 Medicare Advantage programs as well where people can access their drug coverage. So what we do during open enrollment primarily is assess for that coverage. And we do that a variety of ways, but we primarily use the Medicare.gov Plan Finder tool that actually allows us to evaluate all of the coverage. So if someone comes to us or they call or they send us in, we have a one-page form, we will actually evaluate all of those plans for them, kind of cut through, you know, all of the jargon and kind of give them a bottom line. And if they actually can potentially save, we can do that enrollment for them as well.
Wow, so you can actually help with the paperwork too?
Absolutely, and we do that throughout the year for a variety of different things as well. We assist with mass health, we assist with public benefit programs, troubleshooting throughout the year. We have a couple of tricks in our pockets of how we can help people. So we function year round.
Okay, great. Now, you were talking about how the insurance programs can change. Well, also, I would imagine the subscriber's health condition changes.
That is absolutely.
Your personal medications might change.
Yes, so that's also something that can be evaluated. I can't tell you how many times someone will come into the office and they'll say, well, I chose this program because it worked for my neighbor and he's had great success, or, I signed up for this program, perhaps 10 years ago because I wasn't taking very many medications and I've had no problems with them. Brand loyalty in this particular instance is not necessarily a good thing, because you're literally switching from one plan to another. I had a pretty significant case, but they saved almost $1,200 a year just from switching from one pharmacy to another. And it's not at all uncommon for individuals to save money by switching.
They saved that much money? A Berkshire County person?
Yes.
Saved $1,200 just by reviewing their policies with you?
Yes.
Magnificent.
The conservative estimate is that approximately 72% of Medicare beneficiaries are in the incorrect plan, that they could be saving more money, getting better coverage that suits their needs. That's actually a conservative estimate. I've seen estimates, in the low 90s. And
Wow.
And it is old data, but the data from the Kaiser Foundation says that about only 8% of Medicare beneficiaries take advantage of this. So it's really something we're trying to shake up. This should be an annual checkup, just like you go to the doctors. You check up on your auto insurance, things like that. Checking up on your Medicare. It can be as simple as 10 minutes, and we really try to reach out to people. Through the central office, we actually have a one-page form that we will send out to anyone who requests it. Front information, their basic demographic, on the back a list of their medications. We'll actually run the numbers and call them, and it could be about 10 minutes of their time invested to actually see if they can save some money.
Wow.
And then also on that form, there is a voluntary request for getting financial information. If they don't fill that out, that's fine. The only reason we're asking for that is we're also simultaneously screening them for other programs, so that if they come in for a drug checkup and we see that they could potentially qualify for, the buy-in program, which would pay their Part B premium, or Health Safety Net, which would help them with their hospital coverage, or Prescription Advantage, which we'll talk about as well, I hope, today.
There are many levels to this program.
Yep, so it's a small time investment on the part of the beneficiary to kind of have a large potential savings.
That is significant. That's a very valuable resource. And again, you don't charge for this.
Never. No one should ever pay for this information. There are private brokers out there, but this information is widely available. You could retrieve most of it on Medicare.gov. Shine and the Executive Office of Elder Affairs, we put a lot of effort into maintaining accurate information, and then we kind of break it all down. And it's free to anyone, regardless of income or assets or age. So if someone is perhaps disabled and on Medicare, or will be eligible for Medicare soon, they can certainly come to us as well. You don't have to be 65 or older for our services.
Okay. Now, I think that's one of the big barriers is everybody goes, oh yeah, go to Medicare.gov, all the information's free, yet that can be so overwhelming. So essentially, your volunteers and your staff weed through that?
Yes.
Okay.
So all of our volunteers undergo an initial training of about 50 hours, which is it's pretty intensive. There's a state exam that they have to pass. We undergo a mentoring process as well, and then all of the counselors do monthly ongoing training to make sure that we're up to date and accurate. And we've actually, with the help of the state SHINE program, we've put together lots of tools that allow us to get through that information very quickly, so that when a beneficiary leaves a SHINE appointment, they should have a solid understanding of the basics of Medicare, what they really need to know, and how they can get that, and what to do if they run into a couple of common problem situations. So when they come in, we're dealing with their initial problem, but we also like to do as much education as possible to make sure that people are prepared, because this really is something that should be part of your lifestyle once you're on Medicare.
Certainly, but it can, again, seem so overwhelming. So it's wonderful to hear that your network is out there to help people. I think one of the background informations for those of us uninitiated, what is A, B, C, D, safety net?
Sure.
You know?
I'm sorry, I get ahead of myself.
No.
So the basic Medicare, basic bare bones Medicare, I try to think of it as two sides of the same coin, two tracks. We have traditional Medicare, which is what most people are on, A for hospital, B for doctors, and D for drugs. And then they have the option to purchase a supplement plan. That's one side. Now under traditional Medicare, if someone has no other coverage, their first day in the hospital, this year it was going to be, the deductible is $1,288, which is, you know, a significant cost. So we look to programs that can help offset that cost. The health safety net is one of them. You know, your Part B is your outpatient medical coverage, which has a $166 deductible, and then once that is met, the beneficiary typically pays 20%. The Part D is the 26 standalone drug plans that we talked about that are highly individualized. And then we have supplement plans. And this is kind of another message that we like to spread out there. We're actually really lucky in Massachusetts because we only have two types. In other states, they go A through L.
Oh my.
So your basics, we have the core plan, which give or take is about $100 a month, and that covers all of your copays at the doctor's office. So that 20% you won't pay after the deductible. And then we have the Supplement 1 plan, which is about $200, although the least expensive one is $182 a month, which is costly, but you pay no copays at the hospital, no copays at the doctor's office, and no copay at a rehab stay as long as it's Medicare approved. So that's a lot of information right there. The two great things that we have in Massachusetts as well is A, they're all regulated by the state. So as long as you're talking about the same type of plan, you're talking about the exact same coverage. There are no networks, there is no difference. So for example, and you'll have to forgive me, these are last year's numbers, we'll be getting our update soon. You know, Blue Cross Blue Shield could charge $182 for a Supplement 1, while Humana, I believe it was $260 or right around there. And they're the exact same plan. So we're talking about a way that we can rapidly save someone some money without sacrificing any change to their coverage. The other great thing about Massachusetts and these plans is these particular plans have rolling open enrollment, which means you can make changes anytime throughout the year, and coverage will take place the first of the following month. So, you know, let's say you don't want to purchase a supplement because they're expensive, and you're going along and everything's fine, and then you go to the doctor and you find out that you have to have surgery. You can actually sign up for that supplement. Coverage will take place the first of the following month, and you can receive full coverage for that procedure.
So regardless of pre-existing and that whole game?
There are no clauses, and you can do that.
That's fantastic.
And the only reason that they could potentially bar you coverage is if you did not pay your premiums. So you could jump in and out. The rules are a little bit different for people under 65 who are affected by end-stage renal disease, but we could certainly help, you know, those individuals as well. So that's kind of one side of the coin. That's what most people are kind of picking and choosing from, the a la carte model. And then the other option we have is Medicare Advantage, which is known as Part C. Medicare Advantage is probably most similar to what people had while they were working. It's a bundle where the drug coverage, the hospital, and the medical is all bundled together. If you purchase a C plan, you don't have the option to purchase anything else. We have two companies in Berkshire County. We have Health New England and United Healthcare, which is affiliated with AARP. Health New England is an HMO. United Healthcare is a PPO. And the people who most frequently benefit from those types of plans are low frequency users, someone who doesn't mind having a network of referrals, someone who doesn't take very many medications or costly medications because they tend to cost more on these plans. You know, but They're a nice middle gap coverage, and they provide extra wellness benefits that you wouldn't receive under Medicare. You know, money off a gym membership, hearing exams, things like that. And you know, we would certainly review all of these options with anyone who is interested.
Okay, so again, if you've had any changes in your medical condition, positive, up, down, what if anything has changed in your regular health and medical routine, you should definitely call a Shine person.
Yeah, absolutely.
Okay.
And you know, open enrollment is the time during the year when everyone can make changes. But if someone has a significant situation in the middle of the year, like I said, we do have a couple of tricks up our sleeves that we can try to get people their coverage changed.
Okay. So if somebody finds themselves in dire straits outside of open enrollment, there may still be an option for them?
Absolutely.
Wonderful. That's great to hear. Now, one of my questions is, that's great. I understand the Medicaid and Medicare part, but what if you're on a company retirement plan and your medical insurance is covered under your retirement, so you're not necessarily pulling from Medicare? Can you still pull the other bits and pieces down?
It really depends on your situation. Depending on your specific company. And we do get those requests pretty frequently. You know, someone wants us to help compare what's available through their employer as opposed to what's under Medicare. And we're happy to do that as long as someone brings in their write-up from the employer or their policy so that we actually have something to work with. Okay. It really depends. So for perhaps a city employee, their drug coverage and their supplement are bundled together. And if you start pulling pieces apart, you're going to have a problem. and we wouldn't do that. So for people in that situation, we would refer them back to their benefits officer, specifically about their plan. And in that situation, their plan is actually much better than what you could get on the open market.
Okay.
And then we kind of have other people who, specifically in Berkshire County, we've seen this change over the last few years, where employers are kind of ending their employers. I don't want to say ending their employer-sponsored health care, but they're changing it, and they're going through brokers now and offering a subsidy. Crane has done it, GE has done it, GE over the last 2 years, and now this year Eversource will go. So instead of having that kind of private marketplace plan, beneficiaries will now have the option to purchase their insurance, Medicare insurance, through a broker, and they, depending on their company, can potentially receive a stipend in return.
Okay.
It's really, for those people, it's kind of a catch-22. They, specifically for individuals who are affiliated with one of the organizations who are brokering through one exchange, they have to do the enrollment through one exchange.
Okay.
But the rules vary from company to company, exactly what you have to do in order to meet that stipend.
Okay.
So for example, last year with the GE retirees, they had to purchase at least one product through one exchange to qualify for their stipend, which gave us some wiggle room. So because the broker is only offering a portion of the plans available to Medicare, what we were doing for the folks who came to us is we were evaluating both types of coverage and trying to find out the least expensive one for them. We'd purchase one product from one exchange, and then if we could save them money on the open market, say if we purchased their drug plan through one exchange and their supplement on the open market, we were actually able to save them some money that they would not necessarily have been able to do if they had just gone through one exchange.
Okay.
It's a little complicated, but
yes, but it is miraculous that all these analysis tools and resources are right here for anybody in Berkshire County. Well, anybody?
Anybody.
Anybody, regardless of age or situation or economic level?
Yeah, we're more than happy to help. During open enrollment, full warning, it is our by far our busiest season.
Sure.
So patience is much appreciated. You know, especially if you're calling our central office. Please leave us a voicemail and we will call you back. It might take us a few days. We're not ignoring you. We just want to make sure that every person we talk to, we're providing a high level of service to, and making sure that we're resolving their problems. So, you know, by delaying a little bit and actually completing situations before we move on, we're actually able to help a lot more people.
Okay. Now you refer to your central office, and that is Elder Services.
It is.
Offices here in Pittsfield. But then you also said you can go through your councils on aging?
Yes, many of the councils on aging have Shine counselors that visit either weekly or bi-weekly, and to provide the same kinds of services that we do at the central office.
So you don't have to come to Pittsfield or operate through the mail. You can meet face-to-face in your town.
You can. You can.
Wonderful.
During open enrollment, appointments are a bit harder to get, just because it is easier for us to serve more people by phone and by mail and things like that. Last year we served about 3,500 people. You know, we had about 30 counselors last year, so that's a lot of work that was actually, you know, done, which is great. But they can make those appointments. And then if someone has a problem that is more complicated but not as time sensitive, it's possible that we will triage them during open enrollment and then have them come in immediately after to fix, you know, that longer problem. If someone needed help with a mass health application or something of that nature, we would, you know, kind of work with that.
That's fantastic. So all filling out those forms and negotiating transitions in your life, you're available for that year round. Wonderful, wonderful. Here's another, there's so much lingo associated with this.
I know, I apologize.
Oh, it's not you, it's coming from the top down. What is the donut hole?
The donut hole. Okay, so good question. The donut hole is a coverage gap in the Medicare drug coverage system. It's getting smaller every year, and it's scheduled to close in 2020, which is great. But the costs have to go somewhere, so I'm pretty anxious to see how that will work out. But essentially, once the total retail cost of a person's medications has reached a certain level, this past year it was about $3,300, their cost share goes up significantly. Last year, when you are in your initial drug coverage period, you pay about 25% of the cost. Once you hit the donut hole, you pay 45% of the cost for brand name and 55% of the cost for generic. That's a large increase for several people.
Yes.
So, and then that continues until you've reached catastrophic coverage. So that's a problem.
I would imagine so. The cost of medications these days, $3,000, $3,300 is not unheard of.
Yeah, well, and a lot of people think, well, that will never happen to me. I never spend that much on my medication. But what they don't realize is it's the total retail cost. So what your plan is paying out and what you are paying out to get to that number. So that is another reason why it's really, really important to choose the correct plan, because the plans are allowed to set their own formularies. So while one plan might say something is a tier 2 and has a certain cost, someone else might say it's a tier 3 and it's more expensive, you'd get to the donut hole faster. The other thing that we do to address the donut hole is a program called Prescription Advantage. It's free for most people. There are 5 tiers, up to about $35,000 a year for an individual is free. It's about $58,000, I believe, for a married couple. And then we have tier 5, which is kind of another ball of wax. But and for these people, once they reach the donut hole, rather than paying that percentage, they pay a set copay based on their income.
Oh, fantastic.
So instead of paying, 45% of that, $400 inhaler, you would pay a flat copay of $18 or $30. Okay. And that steps in. The other great thing about this program is the application is very simple, and it's not something you have to do annually. They're pretty good at renewing your paperwork, and every single member gets a special enrollment period every year. And well, what is that?
Yeah.
That is something that I like to refer to as a get out of jail free card. So it's basically an opportunity to change your plan during the year outside of open enrollment. and it's just sitting there waiting for you. So if someone comes into the office, we generally encourage them to apply for this program. We help them so that it's sitting there waiting for them, even if they don't anticipate hitting the donut hole, because that opportunity to change very quickly when needed is very great. For people who are in the higher income threshold, I believe it's up to about $80,000 for a married couple. There's a higher tier, and it's $200 a year. And they don't have the same coverage benefits, so it's much closer to catastrophic coverage. So if someone was in that situation, we would want to run the numbers to make sure it was worth signing up for them. We wouldn't just arbitrarily say sign up for this. We would help them work through that process and see where they stood.
What an invaluable resource you are to the county. That's amazing. That is amazing. I also want to point out to everybody that you will be taking this instructional introduction to Medicare and open enrollment around to all of the councils on aging, right?
Yes.
And there is a schedule. Matter of fact, I remember publishing in October issue of Berkshire Senior Newspaper, there is a schedule of when you will be at what councils on aging, so people can get an opportunity to come see you in person and ask questions specifically and learn how this impacts them directly and how to sit down and have this analysis done.
Yes, I won't actually be doing all of those presentations. Some of the local Shine counselors will also be giving presentations, but they're absolutely wonderful. So you don't have to speak to a specific Shine counselor. They've all received the same level of training.
Okay.
So that's another important thing. You want to.
Right. So again, Shine is, what'd you say, 50 hours of training
50.
plus a state exam?
Yes, and then mentoring after that.
And mentoring to volunteer.
To volunteer. And then
That's wonderful. God bless them.
Ongoing educational requirements as well.
Wonderful.
They're all Corey checked.
Great.
And references and everything.
Wonderful. Thank you very much. Again, Shauna Post, she's here with us for open enrollment. I am Rhonda Sayre with Elder Services of Berkshire County. And please be sure to check out our website, www.esbci.org, and call 499-0524 to meet your Shine counselor. Thank you, Shauna.
Thank you very much.
I've been out till 2:45. Would you lock the door? Will you still need me? Will you still feed me when I'm 64?